Hello students, my name is Dalshin Dalilkhan Kızı. I'm a teacher from the Department of Children Infection Disease. Today I will show you my lecture about viral hepatitis A and E in children. According to my lecture, we will give definition of this disease, we'll tell about etiology, epidemiology, and clinical manifestations, diagnosis and treatment of these diseases. At first, what is a hepatitis and the nature? Hepatitis is inflammation of the liver. And the viral hepatitis A is an acute viral infection, cyclic infection disease, characterized by short-term symptoms of intoxications, rapid violation of liver functions, and benign courses. The pathogen is RNA-containing virus from the family of Picornaviridae. They contain RNA and they're located on the cytoplasm of hepatocytes, and they can find in the feces or from the period of pre-jaundice. The epidemiology of disease. Mostly children aged from the 3 up to 7-10 years mostly get sick by this infection disease. And it's one interesting fact, babies from the first age of their life doesn't get sick by this infection because they has transplanted antigens from their mothers. And this is anthropootic infection, the source of infection only sick person to the healthy person. And transmission mechanism is fecal oral from these ways. First is watery by contaminated water. Next, alimentary, eating contaminated fruits, vegetables. Next, household or contact ways, using, for example, common dishes, swimming in the dirty water, for example. And the disease has seasonality, mostly autumn-winter period. Classification of HAV infection. They, by type, divided to typical and atypical. Typical means with jaundice, atypical without jaundice. And HAV infection, always acute infection. There are no chronic form of this infection. And according to the severity, we will divide it to mild, moderate, and severe cases. Mild form has mild intoxication plus the number of total bilirubin will be rises up to 100 micromole per liter, and the numbers of prothrombin index will be up to 80%. And moderate forms, symptoms of intoxication is moderate pronounced, total bilirubin will be increased up to 100-180 micromole per liter, and prothrombin index decreased to the 60-70%. And severe cases during this acute severe intoxication plus number of total bilirubin will be more than 180 micromole per liter, and prothrombin index will be decreased up to 60-40%. And the clinical picture of HAV infection during these 4 periods. First of them, incubation period. Next, prodromal period calls pre-jaundice period. Initial period calls jaundice period. Then post-jaundice or period of reconvalescence. In incubation period of HAV infection lasts up to 750 days. In the middle, 45 days. There are no clinical symptoms in this period, but virus already can be detected in the blood, and by biochemical blood analysis you can find increased of activity of liver enzymes like ALT and AST. Pre-jaundice period can be during this variety different syndromes. First of them, dyspeptic syndrome. Baby has fever plus nausea, vomiting, abdominal pains, sometimes liquid stool. Next is flu-like syndrome. Baby has intoxication, headache, malaise, dizziness, for example, arthralgia, myalgia, like flu. Next is asteno-vegetative syndrome. Baby has fever, lethargic, weakness, lack of appetite, and the latent without symptoms. Peak period or jaundice period it starts from the appearance of the jaundice. Jaundice usually appears from the third 5 days from the illness, and one of the main sign of A hepatitis to differentiate from other hepatitis is with appearance of jaundice, baby feels themselves better. Intoxication and condition will be improved. At the beginning, jaundice will be appear from the sclera, then to the face, skin face, then to the trunk, and later to the limb. And the patient turned yellow overnight, for example. And the jaundice persists mostly 7-10 days, then gradually is decreased. In this period, the size of the liver will be rises as much as possible, and the edge of the liver is compacted, rounded, and the painful palpation, and the color of the urine and the feces will be changed. Mostly feces is discolored, and the urine will be dark color, like dark tea, dark beer color. And in the period of reconvalescence, it lasts 2-3 months, sometimes more. In this period, the laboratory changes and the clinical manifestation gradually will be decreased and normalized. That's all. Next, about viral hepatitis E. There are two hepatitis, HAV and HEV. They are included in one group, fecal oral route hepatitis. According to this, we will study there today together. Viral hepatitis A, viral hepatitis E, this is acute viral infection during this damage of the liver and characterized by severe cases in pregnant women. The pathogen is RNA-containing virus from the family of herpesviruses from the diameter of 34-35 nanometers, and it's characterized by fecal oral mechanism too, mostly watery route, and it's more meets in the tropical and subtropical zones, climate countries, and it can be affect common young people from the age of the 15-30 years old. And the epidemiological feature of the HEV infection in children, they has explosive nature in of the flashes, and this is more important factor. This infection danger for young pregnant women. Because the pregnant women has a specific hormonal phone, and here this infection will be severe cases. Incubation period lasts 25-65 days. In the middle is 35 days, and in the incubation period no cycles, no signs, and the infection during with the periods like HAV infection 2 and jaundice periods will be like HAV infection, but with appearance of jaundice, baby intoxication not be improved. The condition will be worsened. This is differential sign from the HIV and HEV infection too. And the weakness, the signs is lack of appetite, nausea, abdominal pain, painful on the right, hypochondria mostly. And next we already said, like this infection mostly has a danger for pregnant women from the second half of their pregnancy, and there can be complicated by DIC syndrome, hepatic encephalopathy, and etc. We will doing differential diagnosis of HIV and HIV with other viral hepatitis spreads by parenteral route, mostly BCD hepatitis, and first sign is, of course, is transmission way. In HIV and EV infection, it's fecal oral. For BCD infection is parenteral route, any blood anamnesis, and acute onset of disease in HIV and HIV infection, and the viral hepatitis BCD can be starts gradually, and they has chronic forms, and next of them chronization and with appearance of jaundice. The common condition of baby will be worsened in BCD and E hepatitis. Only in A hepatitis with appearance of jaundice, baby feel himself better. For diagnosis, we are using general clinic methods and specific laboratory tests. First of them is general clinical methods. We will using CBC. For CBC, there are no any specific change. Sometimes you can find normal or lymphocytosis. ESR mostly is normal. More important for us is biochemical blood analysis. Here we will find increase of the total bilirubin due to the direct fraction. And direct fraction will be increased, and the increased activity of liver enzymes ALT and AST. And urine analysis will be present. Bile pigments and color will be changed too. Specific laboratory tests to confirm diagnosis are serological test of the blood is ELISA. By ELISA, we will find specific markers of hepatitis. For A hepatitis, there are anti-HAV IgM. It means acute infection. Anti-HAV IgG means past infection. And sometimes you can doing PCR to finding RNA of HAV. But for confirmed diagnosis, finding IgM will be enough. And for HEV infection, the marker will be anti-HEV IgM and IgG. And by PCR, finding RNA of HEV infection. Treatment. For treatment, it's more important saving non-drug treatment. First is regimen, should be bed rest in pre-jaundice period and the jaundice periods too, and the saving diet number 5 and 5A, and giving oral desintoxication therapy. It's drinking more fluids, for example. Drug treatment for A hepatitis not needing. A hepatitis can be treated by himself without any treatment, but sometimes if a baby has severe intoxication, we can doing with this intoxication purpose, giving fluids. Mostly is 5-10% dextrose, 0.9% sodium chloride, and for even the function of the liver will be damaged. We needn't to using any medicamentations. Only in rare cases, for example, for release of fever, we can using antipyretics. That's all. And there are no specific etiologic treatment. What about prevention? The prevention is divided to non-specific and specific. Non-specific prevention, it's more important too for both of these hepatitis. These are saving hygiene, wash the fruits, vegetables with the hands, using separately dishes, no swimming in the dirty water, for example. And about specific prevention, we will use vaccination from A hepatitis. Vaccination can be used from the children aged of the 2 years, and using inactivated hepatitis A vaccine called Havrix, and carried out 2 times and with interval of 6 months. And that's all. My lecture is over. Thank you for your attention.